Hello, I was wanting to talk to you today about distal biceps tendon rupture. Your distal biceps tendon is a tendon that goes from your biceps muscle down into your forearm. And your biceps muscle is a muscle that gives you quite a lot of function. It gives a significant amount of forearm flexion strength and also forearm rotation strength. So if unfortunately the distal biceps tendon is pulled out of your forearm, it ruptures, then you tend to lose quite a lot of function. And therefore most people who this injury happens to will choose to have the tendon repaired back down to the bone. If you have a distal biceps rupture, what tends to happen is you'll be using your arm for something. Most people feel a pop in this area and some pain, and your biceps muscle for most people will change shape. It'll go more proximal. Now, if that happens to you, you'd usually go and see a doctor, and most of the time they'll make a clear diagnosis, a lot of the time simply from being able to look at your arm, but sometimes it helps to do investigations such as an ultrasound or MRI, and here's an ultrasound I did, and you can see there's the end of the tendon. It's meant to be down here in your forearm. If we repair the distal biceps tendon, there's a number of ways of doing that, but the way I do it is it's relatively specialised in terms of we tend to do it through usually one very small wound, and through that small wound we'll put a telescope and do two things. So we will find the end of the tendon. So there's the end of the tendon that's up in the forearm, and that's looking at it through the telescope. So find the end of the tendon. We'll be able to bring that out through the very small wound that I've made, and then we find where the tendon has come from, put an anchor into the bone, put stitches through the tendon and tie the tendon back down onto the bone. In this next picture here you can see there's the tendon with a stitch in it being pulled down into the bone. There's a little anchor on the other side of the bone which you can see here on the x-ray, and then the end construct is like this. So you've got the tendon, comes down into the bone and is held there by the anchor. Now when we do this operation, what we're doing is putting the tendon back into the bone, but that's not nearly as strong as it was prior to injury. It's the strongest we can make it, and where the strength comes is from the tendon healing back to the bone. Of course, healing takes quite a long period of time. So for 6 weeks after you've injured your arm, you have to be incredibly gentle with it. It's okay to use a mobile phone, okay to pick up a coffee cup, usually okay to drive, but anything at all manual you just mustn't do because you risk pulling the tendon out of the bone. Then for a further 6 weeks we get you to take things very, very lightly, and during this whole time you're seeing the hand therapist and doing exercises and rehabilitating your arm, but really we don't start strengthening until around about 3 months after you've injured yourself, and it takes ultimately about 9 months for it to get maximally strong again. So it's a slow recovery, but as I've mentioned, it's really very important muscle, and most people would really miss its function. So for the vast majority of people, an operation is worthwhile. There are a few risks having any operation, including this one. The risks certainly to me seem very much reduced by doing it through the telescope. There's a small risk of injury to the nerves or blood vessels. There's a small risk of bone forming around the repair, which I have not seen with this technique at all. And there's a small risk of it rupturing again, but that risk is reduced by careful rehabilitation and using it very gently for the initial period. So I hope this information has been useful for you. Certainly if you feel you have a distal biceps rupture, then it's very important to see your doctor as soon as possible. This is certainly something that's much better treated in the first few days, or certainly a very small number of weeks, because after a period of time it becomes hard and more complex to repair. Take care.